Okay, good afternoon everyone and welcome to your Skin, Health and Wellbeing event. Thank you for joining us today. My name is Noah and I'm the Macmillan Health and Wellbeing Coordinator for the South Eastern Trust and I'm based in the Ulster Hospital. Before we start, for confidentiality reasons, all attendees today will not be visible to other attendees or panel members. Panel members are aware of those who have registered for the event, but cameras and mics are not functional, so we won't be able to hear or see you. You will, however, be able to engage with the event, and I will explain more about how you can do this later. So what's today's event about? Well, from speaking with patients and their families, we've been told that whenever they've completed a certain amount or finished their treatment, it can be hard to know what happens next and who you can talk to. We recognize that this can be a difficult time. There was a strong need for information and support, not just about the clinical follow-up, but relating to the broader issues associated with recovery, such as emotions, returning to work, physical activity, and travel, to name a few. So today's our way of coming together to remind and reassure you of all the help and support that remains in the system for you and how you can get in touch with us. Today's event will help you learn more about follow-up, what to expect, who to contact, and when to do so. It's also an opportunity to find out about the information and support that's available to you during your recovery or living with a diagnosis. There are a whole range of supports and services out there who can provide guidance and help you to live well with or after cancer. Service can help signpost you to them. You will see on the program that you'll shortly be hearing from some of our healthcare professionals. We've pre-recorded these presentations, but our speakers are here for any questions you may have. All questions can be sent using the chat function. This can be found at either the top or the bottom of your screen, depending on what device you're using. You will see 3 dots. Once you select that, you'll be given an option to use the chat feature. Questions will only be seen by panel members, and we'll answer all questions at the end of the event. We understand that everyone's journey is different, but there are common themes which emerge that affect people, such as fatigue, building your strength and stamina, building your self-confidence, dealing with some of the emotional implications of having had a diagnosis. I think it's very important to recognize you're not alone if you're experiencing any of these things I've mentioned, but it's also important to note that there is lots of help and support out there. Today is really about taking the chance to review things, seeing if there are areas of your life that can be improved, helping you take ownership of your recovery and self-care, and starting to put pieces in place that are going to help you live really well. So with that in mind, I'd like to hand over to our first speaker, Mr. Jeremy Bond.
Thank you for allowing me to speak today at this event. My name is Jeremy Bond. I'm one of the plastic surgeons at the Ulster Hospital Dundonald, and I wanted to speak to you today, particularly about surgical management of skin cancer and also how we follow it up in the health service today. Just by way of an explanation, a lot of people are surprised to hear that plastic surgeons are involved in skin cancer management. Plastic surgery itself was born out of the First World War by this gentleman who's called Harold Gillies. He was an ENT surgeon, but he made a name for himself in the First World War by reconstructing injured servicemen, particularly servicemen who were injured in the head and neck area. And a lot of the fundamental techniques that we still use today were based on a lot of his experience and early work. We are involved particularly on the reconstructive side, and that's where our involvement, particularly in skin cancer, originates from. So why do we use surgery in the management of skin cancer? Well, it's really for a number of reasons, the main being that excision is still the mainstay of treatment for the primary. So if you develop a skin cancer, the mainstay of treatment is still to surgically excise it in order to ensure that we get control of the disease and that we get clear margins. But we're also focused on trying to ensure that particularly function and also cosmesis are unaffected to the best of our ability. So it's important to try and remove the primary tumor, but at the same time ensure that we are as user-friendly and as there's as little destruction and complications for the patient as possible. I mentioned control or local control. We tend to, when we're removing a skin cancer, use an excision margin, and that essentially is placing a little bit of extra tissue around the outside of the primary lesion. For example, in this gentleman, he has a basal cell carcinoma on his nose. Basal cell carcinoma is a fairly slow-growing, non-metastasizing type of skin cancer, but we've found from experience that putting a 3 or 4 millimeter margin around the edge of it will ensure that we, to the best of our ability, and in most cases have it completely excised whenever it's reviewed by the pathologist under the microscope. So we tend to apply that logic to all sorts of tumor groups. Bottom right-hand picture, you can see it. This is a melanoma on this gentleman's leg. And in this particular instance, and for most melanomas, we will resect it usually with about 1 centimeter in order to try and ensure complete clearance and reduce the risk of local recurrence. Margins are not set in stone, and depending on the anatomical site, there will be differences in relation to the amount of complications that you could expect. So if you look at the picture on the top right, this is a melanoma on somebody's lower eyelid. And if we were to put a centimeter margin around that, you can very quickly appreciate that the whole lower eyelid would potentially be resected, which would create a fairly substantial reconstructive problem and obviously open the patient to more morbidity. So in those sort of cases, and particularly where there is a major issue with, say, a sensitive part of the anatomy, resection margins will sometimes be discussed and augmented in order to try and achieve a balance between complete excision and local disease control versus cosmesis and functionality. So how do we go about these sort of things? How do we reconstruct things particularly? Well, it's a progression, and what we tend to have in our back pocket is a number of different options in terms of trying to reconstruct certain things, and we proceed through those options in logical fashion, getting more invasive as we proceed. And it's very often represented in this way as the reconstructive ladder. So at the bottom of the ladder, you've got secondary intention healing, which is basically a fancy way of just saying leaving it to heal by itself. Primary intention and primary closure essentially allude to the same thing, which is just to suture the wound together. You then can move on to skin grafts, and then more complicated types of reconstruction such as tissue expansion and local and free tissue transfer, which we'll touch on briefly. So this is just a couple of examples. This is a lady who had a basal cell carcinoma removed from the nostril area, and you can see the wound on the left-hand picture. Ignore the other little lesion in the superior part of her nose. That wasn't treated, but you can see in the picture on the right, this is probably about 6 weeks later, and this is purely just through secondary intention healing, allowing the wound to heal by itself without any particular surgical intervention other than excision of the primary lesion. And you can see it actually heals with a fairly reasonable result, which will continue to improve. If we move on to direct closure, primary closure, again, this is usually reserved for cases which are too big to leave to heal secondarily. And secondly, where there is enough laxity in the skin in order to permit direct closure. You can just about see in the image on the top, the skin is under a little bit of tension, but generally speaking for the face, that's okay. And the skin will very often recover, become more elastic and supple with time. And as a consequence, you can see a couple of months later, the scars are actually barely perceptible and it's healed with an excellent cosmetic result. It's a general rule that as we get older, our skin becomes slightly less elastic and it becomes more amenable to direct closure under these sort of circumstances. And if we can possibly do this, we generally try to close these sort of wounds directly. And moving up the ladder, this is an example of a skin graft. So this gentleman again has had another basal cell removed from the bridge of his nose, just on the left side. This is the graft at about 13 days, 2 weeks. You can see it's quite swollen still, and it's recovering. It's quite red, but it has survived. The skin is all viable and is in place. Generally speaking, these grafts will be taken really from wherever you can get them. A lot of the time it's on the neck, it can be behind the ear, you can take it from the upper inner arm, any area. These grafts are the full thickness of the skin, and they provide a very good colour and contour match. And you can see it at about 3 months there. There is a scar. The skin does look slightly different and a slightly different skin tone, but has healed with a reasonably good result, and one that you'd be reasonably happy with. So that's an example of a skin graft, and in this particular occasion, a full thickness skin graft. If we take it a step further, and if we look at what we call local tissue transfer, and this is an example of a gentleman with a melanoma on his scalp. You can see that a resection margin has been placed around it, in this case about 1 centimetre. And I'm sure you can appreciate, feeling your own scalp, that if we were to excise that and attempt to try and close it, we wouldn't close it at all, wouldn't be possible. You could put a skin graft on this, but in a gentleman with a full head of hair, it would leave him with a fairly sizable bald patch, which would probably not be cosmetically acceptable. So in this particular instance, we've marked out what we call a scalp rotation flap. The scalp is very well supplied with blood, and as a consequence, you can utilize that excellent blood flow to design these transposition, these flaps, which will move and slide into position, retaining some of the, or taking advantage of some of the laxity in the scalp to allow the wound to subsequently close directly. In certain instances, particularly on the scalp, you can get away with direct closure, but you have to work for it, I suppose is what I'm getting at. So this is an example of a scalp flap, and it's an excellent option for people, certainly with a full head of hair, who want to maintain that. So that's the surgical side of things, and that's treatment of the initial primary. We're also involved in other aspects of particularly melanoma management, and especially at the primary excision stage. And one thing we've introduced in the last couple of years is this concept of sentinel lymph node biopsy, which is specific to melanoma particularly. Every patch of skin on your body will drain what's known as lymphatic fluid. And that lymphatic fluid is useful and used in the immune system, and it drains to regional lymph nodes, which are characterized as the lymph node basin. And these lymph node basins are collected in places like your groin, your armpits, and in the head and neck region particularly. Within those lymph node basins, there are a number of lymph nodes which reside. In the groin, there's probably anywhere from 10 to 15. In the armpit, probably up to 20. And in the head and neck region, there can be 40 or 50. If a melanoma is to spread from a site on your skin and travel, if the cells of that melanoma are due to travel to a lymph node basin, it will preferentially lodge and enter one of those lymph nodes in the basin first. And we do a thing called sentinel lymph node biopsy, which allows us to try and identify which lymph node that's likely to be. And at the same time as the primary excision, we can remove that lymph node. And the advantage of that is that we can send that lymph node off to the pathologist and ask him to look at it and see whether or not there's any melanoma within it. And if there's not, well then that's as accurate a staging investigation that we have to sort of give you at that point the all clear. If it is involved, then it means we have a very early sign that there is metastatic spread, and we can institute some therapy to try and counteract that. So like I say, if the lymph nodes are involved, we can manage that. Now, occasionally some patients will come to us with a palpable lymph node. So say they've previously had a melanoma treated some years back, where no signs or symptoms related to any lymph node involvement at that stage, but subsequently they've then gone on to develop swelling in a gland, which is a result of melanoma. Now, in that particular instance where there is how I describe as gross disease within the lymph nodes, where it's actually physically palpable and you can actually feel it, then what we will tend to do is clear all the glands in that particular lymph node basin, and that's again to try and ensure that control is maintained. And we do that because if one lymph node is involved, there's a good bet some of the other ones could be involved as well. And a safety first policy would be therefore to clear the whole basin. So if it's in the neck, it will be one side of the neck or one armpit or one groin, depending on where it develops. These days, however, we do have a few more tools at our disposal, particularly on the oncology side. And there are a number of different therapies that have been developed, particularly over the last 5 to 10 years. One branch of therapy, particularly for melanoma, but not exclusive to melanoma, it does involve other types, is called immunotherapy, and it's used to potentiate your immune system in order to try and counteract the particular skin cancer that you have. The other main focus, and this is more exclusive to melanoma, is targeted therapy, and that looks at combating specific mutations that are apparent in certain people's melanoma. Drugs can be developed or have been developed to counteract those mutations and to work in combination with surgery. And what's happening particularly at the moment is we're trying to define the best time to use these drugs. Currently, we use them in an adjuvant setting, which means after the primary surgery has taken place. But a lot of the evidence, not only from melanoma, but from other tumor groups, is now sort of suggesting that the neoadjuvant approach may be a better way to do it. So in other words, give the drugs first, followed by the surgery in a slightly more roundabout fashion. Time will tell. But certainly there's certainly a lot of cause for optimism in skin cancer management generally. And as I say, we've never had more treatments available to us at any other stage in history. Just a word about other treatment modalities. Some patients, unfortunately, will develop recurrence of their skin cancer, their melanoma. The traditional mode of trying to manage that is to surgically excise, but there are other options out there. We've already mentioned the oncology side of things and drug therapy. This is just an interesting aside. This is called Electro Chemotherapy, and this is where a cytotoxic or cytolytic compound is injected straight into the tumor itself, and an electric field is applied, a very minimal electric field supplied to the surrounding tissue. And what that does is it changes the permeability of the membrane of the cancer cell and allows these drugs to flow directly in. So it's kind of selective destruction of these cancer cells. And it can be a very good way of trying to manage local recurrence, which particularly in melanoma for some patients can be quite problematic. So these are things on the horizon, things that perhaps in the future we'll be able to offer here as well. But medicine's constantly evolving and new treatments are constantly coming online. Just to mention some of the more simpler, we mentioned basal cell carcinomas before, and again, other modalities which have been used currently in certain units, laser therapy, using laser to ablate basal cells instead of actually surgically cutting them out. From a cosmetic point of view, produce excellent results, but have the disadvantage of not being able to supply you with tissue for the oncologist, or sorry, the pathologist to analyze. So pros and cons to both, but as I say, techniques change and how we manage things is changing and will continue to change. So just by way of finishing, we'll talk a little bit about follow-up. Why do we do follow-up? Well, we follow up people in order to try and detect recurrence, be that local recurrence around the original site or regional recurrence to the lymph nodes. That's why we do it. The majority of it is probably clinical, in other words, clinical examination and meeting the patient face-to-face. But for other tumor groups, particularly melanoma, there is more radiological follow-up with CT and sometimes PET scan, depending on the particular stage the patient is presented with. Ultimately, it depends on the underlying pathology, i.e. the underlying tumor, and also the stage of its development. But that's why we do follow-up, and that's why these schedules are produced depending on what particular type of skin cancer you have. As I said, it involves multiple specialties very often. Radiology doing the x-rays, dermatology maybe doing skin checks, plastic surgery following up the original surgery site, and then obviously oncology if there are drug treatments or radiotherapy involved. In terms of the future follow-up, because of that last point, because there's multiple specialties involved, we're very attuned to the fact that a lot of patients have a lot of appointments. And what we're very conscious of is trying to streamline those. Now, traditionally, they've been consultant-led, so you come to the consultant clinic for your follow-up. But more and more nurse-led follow-up is being instituted. That's partly due to logistics, partly due to manpower. But our specialist nurses are very experienced and very good at this sort of thing, and I think this will probably be the mainstay of follow-up in the future. The other thing that is probably something that we're thinking about instituting at some stage as well is the possibility of self-directed follow-up, or at least putting some of the control back into patients' hands, showing them what we're looking for, particularly on the clinical side, how to examine your lymph nodes, how to look at your scar, what the sort of things that we're looking for, and providing patients with good lines of communication, phone numbers, people they can phone if they're concerned, rather than bringing them up to an outpatient clinic 3-4 months at a time, you know, whether there's a problem or not. So we're constantly looking at different models and different ways of following people up that are effective but also user-friendly. So that's a very quick run through skin cancer, particularly from the surgical side. I hope that's been useful. Thank you for your attention.
Okay, thank you, Mr. Bond, for all the information you provided there. If you do have any questions for Mr. Bond, then these can be sent using the chat function, and we'll aim to answer these at the end. Okay, so you'll now be able to hear from Sheena Struthers, one of our clinical nurse specialists, who will give you some information about ongoing support.
Good afternoon and welcome to the Skin Cancer Health and Wellbeing virtual event. My name is Sheena Struthers and I am part of the Skin Cancer Nurse Specialist team based in the Ulster Hospital in the South Eastern Trust. And today I want to talk about how you access your specialist team. Firstly, the most important thing to know is the type of skin cancer that you have had. And I know some of you will have had basal cell carcinoma, some of you will have had a squamous cell carcinoma, others a melanoma, and some of you will have had a Merkel cell carcinoma. So it is important to know the type of cancer that you have had, and also that you have some information regarding that, be it in a written format or perhaps in some other format that suits your needs better. It is important if you know that, and if you do want further information, please do link in with us at the end of the meeting and we can certainly send that out to you. Or if you feel you want to access further information, please do link in with your Macmillan Health and Wellbeing Centre to get further information. Firstly, the most important things to check following skin cancer surgery are to check your scar or check your skin graft for any change in pigment, any change in colour really in and around that area where you have your skin graft or your scar. And this is so important for you to be able to do this. And that means that you're working in conjunction with us in relation to your follow-up treatment and care. You also check for any new lumps in that same area. So check under the scar, run your finger along it, and if you see or feel any lumps or bumps in that area, please do contact your team. You also check for any new lesions or clusters, as in the second photograph there where you have the little black dots which are outside of the scar, but also could indicate further spread of the skin cancer. Secondly, checking your lymph nodes is so important. I know many of you will have already been given information and advice in relation to checking your lymph glands. So it's so important that you know which actual lymph glands to check. So if you've had surgery in the head and neck area, it's important then to check the lymph nodes in your neck. If you've had a skin cancer on your arm, check the lymph nodes under your arm, in your axilla, in your armpits. If you've had a skin cancer on your leg, it's important to check your groin nodes. If you've had a skin cancer in your back, it is important to check the lymph nodes under your arms and in your groins. So if you're starting to check these, what is it you're actually looking for? So what you're looking for would be, for example, a pea-sized lump, something that moves along under your finger, under the skin. And it's important that you do get familiar with your lymph nodes and checking your lymph nodes maybe once a month And then if you do actually you find something, you do feel there's something of concern, you're able to actually pick that up quite quickly. And we do want to hear from you right away if you do find something like that. And again, we do have information booklets and leaflets regarding how to check your lymph nodes. The next thing that's important is in relation to your checkup appointments. So these are your appointments. So use that time to ask the questions that are relevant to you to get the information that you need. But what are we looking for when we see you at your checkup appointment? What we're checking for is what we've already talked about, any new lesions. Whoever's examining you will actually check the scar, they will check your lymph nodes. So looking for any spread of the skin cancer. We're also there to offer support if there's anything you need. And of course, again, any information or any education that you need in and around some protection, some prevention, or any type of information regarding what we've already discussed in terms of the type of skin cancer you had, or the staging of your skin cancer, any questions that you may have. Use your time well with your clinician to make best use of your appointment time. And I know during COVID, it's been very difficult for some people to have face-to-face reviews. And I know in many areas we're back to that again, but also in some areas, in some teams, it still is virtual consultations by telephone or by some other means. So it is so important that we're all working together. If you're checking at home and we're checking when we see you, then it's important that if there was a problem that we would pinpoint it at an early stage and be able to get you to investigation and treatment as quickly as possible. So if you have any concerns, who do you contact? Well, you check, first of all, you have a clinical nurse specialist, and I know most of you will definitely have a clinical nurse specialist, be that within the dermatology team, could be within the plastic surgery team, or even in the oncology team. You may know a CNS in each of those areas, depending on the treatment and care that you've had. So check you have the contact details for the CNS in the appropriate team if you have a concern. If you can't remember who it is and you know one of the names, contact them and we can all link in with each other and talk to each other if you do have a question or concern. Thinking about the clinical nurse specialist role, it's a very diverse role, but the main thing is that we are there to act as your key worker across your whole pathway. And as I've already said, that can change. The key worker can change, the nurse specialist may change, but most importantly, we're there to ensure that you get the right information and support and advice along your pathway of care. We do have advanced clinical skills, we do have advanced communication skills, we do have leadership skills and decision-making skills, but most of all, we are there to help you if you do have any questions or concerns or anything that you want to talk about regarding your diagnosis, regarding your surgery, your ongoing treatment, or anything beyond that from a support point of view. So if you don't have access to a nurse specialist, I would say that's not probably very common. But if you don't know the nurse specialist, as long as you know the team providing your care, then please contact your consultant secretary, or if you have another contact number, please do ring it if you have any questions or concerns. None of us are too busy to hear from you. That's what we're here for. We're here to answer your questions, answer your concerns. And it's so important that you know exactly who to contact if you have any questions whatsoever. So I really hope that you enjoy the event today. If you do have any questions, we will have a panel at the end, and we were certainly more than happy to answer questions that you may have. Many thanks.
Okay, thank you very much, Sheena. It's great to hear about all the support still available from the clinical team. We'll now be hearing from Maggie Moore, who is the clinical psychologist for the Southeastern Trust. And Maggie will be talking about being more aware of your well-being at this stage of your journey.
Hello, my name is Maggie Moore. I'm consultant clinical psychologist for cancer services here in the Southeastern Trust. I'm here to talk with you for a few moments about my role in supporting those clients who have a diagnosis of a complex skin cancer. For many people, having to face a cancer diagnosis is one of the toughest experiences they may have had to face in their life. And a cancer diagnosis can be very worrying for the person who has the diagnosis, for their family, their friends, their loved ones. It's possible for people to experience a whole range of emotions, such as feelings of anxiety, fear, panic, a sense of helplessness, and these are very common feelings and they are a normal reaction. And it may be enough for people to talk these feelings over with a friend, a family member, or a healthcare professional. Over time, people will find that this will help. However, some people may need additional support if these normal feelings don't lessen and start to become overwhelming for the person. Talking to a clinical psychologist like myself does not mean that a person is mentally ill or that they're imagining things or that they're overreacting. It's just to give a person a little bit of additional support to help them to make sense of their feelings and to perhaps find new ways of coping with the impact of their diagnosis and treatment. So, the most common concern for clients who have been referred to the clinical psychology service and who have a complex skin cancer is fear of recurrence. Fear of recurrence is a fear that the cancer will return or it will progress in the same part of their body or return and progress in another part of their body. Most people will worry to some extent about the possibility of a cancer recurrence. This is a normal reaction for everyone who has had a cancer diagnosis, and it will usually lessen over time as a person adapts to their situation following diagnosis and treatment. However, because skin cancers can sometimes come back, people will be invited to attend for checkups very regularly following their diagnosis and after successful treatment. People are also advised to check their body regularly for any new moles, lumps, or bumps. Most people manage this, although there may be a natural and normal feelings of anxiety about doing this, and also prior to attending for appointments. For some people, they may become overwhelmed with anxiety about doing this and find that they're checking themselves very frequently and thinking about the cancer coming back many times during the day and every day. And this is when someone like Sheena, the clinical nurse specialist, or a doctor involved in your care may suggest making a referral to myself. So what happens when a person is referred to the clinical psychology service? Well, the first thing is an assessment of the client's concerns, their diagnosis, and I ask clients to tell me their story of how their diagnosis came about. I also would explore with the client how they usually manage stress, how they do that now and how they've done it in the past. I really am trying to find out, how does this person cope with stressful things that happen to them in their life? So I would just like to say very briefly a word about coping. What is coping? Well, it's something that is aimed to help us to react to and overcome a stressful thing that happens to it. And there are two parts to it, our behaviour and our way of thinking. Different people cope with different ways when faced with the same type of potentially stressful situation. This is based on things like how we saw our parents coping when we were growing up, or a caregiver, and also things like our personality. For example, are we a glasses half full person or a glasses half empty person? It's also affected by things like our previous experience of stressful times and how we've dealt with them. I always like to remind clients when they meet with me about how much they've achieved so far in terms of their coping with their diagnosis of a complex skin cancer. And I'd like to say that to those of you who are watching and listening to this, that you have coped tremendously well so far. You've had to cope with discovering symptoms, with seeking out medical advice, with going through tests as part of the diagnostic procedure, and then of course with hearing that you have had a diagnosis of a complex skin cancer, dealing with that, dealing with telling family and friends and coping with their reactions, undergoing treatment and coming through that. And throughout all this, you've had to continue to cope with your life going on for you and everyone around you, and all the demands that that is placing on you as well. So on completion of the assessment, I would have a discussion with the client then based on the assessment and try to have a think about what is keeping their problem going and what might help. With many clients, having the opportunity to talk about their experiences during the assessment and share their thoughts and feelings can be enough. Often clients will say to me, Maggie, you know, that is the first time I've had an opportunity to talk about everything that's happened, and I feel that that has really helped me. So it may be the case that we don't continue with any further sessions because they're not required following the initial assessment. But I suppose for some clients, a short number of sessions may be required to help them use their coping skills or to learn new ones. And the model that I would use in my therapeutic practice to help people with this is referred to as cognitive behaviour therapy. So just to say a quick word about what cognitive behaviour therapy is. It's a treatment that has been shown to be very effective in helping people to deal with fear of recurrence, which, as I mentioned earlier, is the most common reason that clients with a complex skin cancer are referred to my service. Cognitive behaviour therapy involves helping the client to understand more about a problem. The general idea of cognitive behaviour therapy is based on how our thoughts, our feelings, our behaviours and physical sensations that we may experience in our body all affect each other. So when cognitive behaviour therapy shows us that these areas are all connected and they're with us all the time. So when someone becomes physically unwell, it can have a knock-on effect on how they think, feel and behave. And they may end up getting into what we call a vicious cycle of worry and anxiety. Cognitive behaviour therapy helps the client realise that the links between these different areas are there and the reasons why they might be getting stuck in this vicious cycle. Cognitive behaviour therapy helps the person to break out of the vicious cycle, and it also helps the person to understand the problem and then learn ways of helping to reduce those uncomfortable and unpleasant feelings. What I say to clients is it helps to turn down the dial on feelings of worry and anxiety. So just to finish, what I want to say is that I feel that the feelings that people who have a diagnosis of complex skin cancer or any cancer are normal reactions to an abnormal situation, and that most people cope well, and that as time passes, people will usually adapt and be able to move cancer from the centre stage spotlight to off the stage, so that they can adjust back to living their life post-cancer and thriving in doing so. Thank you very much, and I hope that this has been helpful. If, having listened to this today, you do feel that you may benefit from talking to someone like myself, Please discuss this with any of the healthcare professionals involved in your care, and they would be able to make a referral to the service. Thank you.
Okay, thank you, Maggie, for giving us a better understanding of the emotional implications of having a cancer diagnosis. You'll now be hearing from myself about the Macmillan Health and Wellbeing Service and the wider supports available to you. And this presentation has also been pre-recorded. Thank you. Hi all. So as you know now, my name is Nar, and I'm the Macmillan Health and Wellbeing Coordinator for the South Eastern Trust. And I'm going to give you a bit more information about the Macmillan Health and Wellbeing Service. We're a trust-wide service here for anyone affected by cancer. We know that cancer doesn't just affect the person that's been diagnosed, it affects family, friends, colleagues, anyone who knows and loves and cares for that person. We're based in the Macmillan Information Centre here in the Ulster Hospital. We have an information zone and a drop-in facility, and our service is here to help answer any questions you may have or get you in touch with the right person who can. We offer support not just to people diagnosed with cancer, but to the public and healthcare professionals as well. In our information zone, we hold a wide range of leaflets and booklets. We recognise that it's so important that you have access to reliable, high-quality information, because lots of the information out there from Google or social media can be inaccurate, not relevant to you, and in some cases actually quite frightening. So we hold all of the excellent Macmillan information and information from all of our partner charities. Our information is located in different points throughout the trust area, in each of the hospitals, in libraries, leisure centres and GP surgeries. You will see that familiar green Macmillan branding. We deal with a range of topics such as cancer awareness, living with and beyond, dealing with side effects, practical issues, information for family and carers, and information on local support. We hold the information in a variety of formats, such as large print and easy read, as well as other languages. We want the information to be easily accessible so that we meet all information needs. If there's something in particular you're looking for or need, just let us know through the chat function and we'll get that sorted for you. We understand that no two people will have the same experience, and this will have been and continue to be very personal for you and your family. But we have found that these key areas emerge, and that's where we would want to offer our support and guidance. Our team is part of the wider cancer services team, and we're very much a catch-all, one-stop shop to help you explore all of the supports available to you. It's a very efficient way for you to get support. So if you're finding there's anything you're coming up against or that you want to talk about, we want you to pick the phone up and have a chat with us. There's no deadline to our support, so you can come to us at any time with any questions, thoughts or feelings which may come up, especially as you reflect back on everything. At this stage, in post-treatment, the areas we focus on more would be healthy lifestyle and physical activity, which you'll hear more about in our next two presentations. We also find that we hear about finances and work at this stage, and we offer work support conversations, which includes things like how to talk to your employer about your diagnosis, letting people know their rights at work when they do have a diagnosis, and how to plan a return to work so that it's successful. At this stage again, managing side effects such as fatigue is another area of our support. And we also offer practical support for patients, which includes transport to and from appointments, advice about travel insurance, or even dog walking services. We understand that there are a whole raft of emotional implications that come with a cancer diagnosis. We find that it's not uncommon for people to feel quite emotional when they come through their treatments. Often, it's only at this stage you can stop and start to make sense of what's actually happened and understand what that means for you going forward. And exploring these emotions and feelings is also a very normal part of of your recovery and moving forward. It can be a very hard step opening up about how you're feeling, but we do want you to reach out. Our drop-in facility operates on Tuesdays and Thursday afternoons from 2 to 4 and Wednesday mornings from 9:30 to 12 in our new Macmillan unit. We offer a one-to-one appointment, which is staffed by myself and 2 support workers. Their names are Gemma and Nicole. We have an in-depth awareness of all of these supports and services available to you. There's so many, but we will talk to you, get to know you, and let you know all of the relevant supports available. And we'll signpost you to them or make referrals where necessary. We're very lucky. It's a lovely service to work for because it's a non-clinical setting. We don't have to watch the clock, and we can spend plenty of time with you so you can tell us where you're at and how you're doing in order to tease out those areas that could be improved, putting things in place that are really going to help build you up and live well going forward. If you have any questions, please get in touch using the information on your screen. Thank you. Okay, I hope you found that information useful and are more aware of the various supports available to you at this stage of your journey. We're now going to hear from Janet Gabby, who is our physiotherapist in the South Eastern Trust. Janet will give you all more information about physio after cancer treatment.
Good afternoon. My name is Janet and I'm a physiotherapist working here in Ulster Hospital in Dundonald. I want to chat to you this afternoon about physiotherapy advice following lymph node surgery. Some of you may have had lymph nodes removed as part of your treatment. This may be in the head and neck area, underneath the arm, or the groin. The following few slides, we're just going to discuss what lymphedema is, who's at risk, and how you can reduce that risk. The lymphatic system is a network of vessels that carries fluid known as lymph from the body's tissues. Lymphedema is the swelling that occurs when this lymphatic system becomes blocked or damaged. It can occur between 20 to 40% of patients who have had lymph node dissection or melanoma. The majority of patients, this will occur within the first 2 years following their surgery, although the risk of developing lymphedema is lifelong. The areas of the body affected will depend where you've had your lymph nodes removed from. If you've had your lymph nodes removed from under your arm, the areas of the body that can be affected would be the hand and arm, the breast, or your trunk area, which includes under your arm, your back, and chest area. If you've had lymph nodes removed from the top of your leg, the groin area, the areas that can be affected can be the leg and foot, and sometimes the genital area. And for those who have had lymph nodes removed from their neck, the lymphedema would be confined to the head and neck area. Who then is at risk of lymphedema? So anybody that's had tissue damage, which involves lymph node surgery, radiotherapy, or they've had a lot of extensive wounds or scarring, where the initial lymphatics which sit just under the skin have been damaged and they're not able to carry the lymph then to the bigger lymph vessels. Other risk factors include infection, also known as cellulitis, wound or drain complications, a build-up of fluid near the surgical wound, which can be called a seroma, or any trauma to the skin, which poses a risk to infection, such as burns, insect bites, injection sites, and cuts and bruises. Other risk factors can be overweight, and being overweight can increase the load to lymphatics, and this can be especially problematic for the lower limbs and legs. If you've got an underlying chronic inflammatory condition, such as dermatitis, psoriasis, or rheumatoid arthritis, that systemic chronic inflammation can pose an increased load to the lymphatics, which can in turn then increase your risk of lymphedema. For the ladies, if you have a bra size greater than a C cup, again, this can pose more risk of breast edema compared to somebody with a smaller volume breast. Pressure from large tumours, especially at the top of the arm, the top of the leg, or the tummy area, can affect the drainage of lymph fluid. If you have a clot where the vascular system has become damaged, and alongside that then you've had lymph node surgery, the two systems aren't working well, and that can pose more of a risk for lymphedema. And if you've had a family history of lymphedema as well. So those are the risk factors for lymphedema. Now we're going to talk about how we can reduce our risk. So how to reduce your risk can be firstly good skin care. So we want to moisturise your skin, look after it, keep it in good condition. It's your protection barrier for infection. Routine skin checks, good nail care, and for anybody with neck nodes being removed, good oral hygiene. If possible, avoid unnecessary injections, blood pressure monitoring, and vaccinations on the affected arm. If you're working in the garden or cleaning with harsh substances or lifting food from the oven, wear protective gloves to avoid cuts and burns and scalds. We also would recommend that you avoid excessive heat like saunas and jacuzzis, because overheating the body can again increase the load in the lymphatics, which can already be struggling if you've had lymph nodes removed. Take care when removing hair from your armpit, leg and face. Use an electric razor to prevent trauma, and if using creams, patch test to ensure you don't have a reaction. Use an insect repellent and avoid scratching bites in the warm weather. Be safe in the sun, apply a good factor sun cream and use protective clothing. And if you do get a cut, a graze or a bite, clean it well, use antiseptic if necessary, and keep an eye on it. If it gets red, hot, or looks angry, or there's a rash, seek advice from your GP, because you may need an antibiotic for an infection. General recommendations would be also to keep your weight within normal limits, as we've said before, especially for the lower limbs. If you're overweight, this will put an increased load on your lymph system, make it more difficult for it to manage. Try and avoid restrictive clothing, so don't have your socks too tight, your underwear too tight, your bra too tight. Make sure your watches and rings aren't tight, and avoid prolonged periods of standing or having your limb in a dependent position. So if you have lymph nodes removed from your arm, try not to have your arm hanging down for long periods where fluid can gather in the lower part of the arm and hand. And finally, being active. Rhythmical exercises will help to pump the muscles and ease any buildup of fluid in the limb. The lymph system isn't like the heart, where the heart pumps the blood around the body. The lymph system doesn't actually have a pump, and it relies on the changes in tissue pressure to help move the fluid through the lymph vessels. So any sort of rhythmical exercises where the muscles are contracting and relaxing will help to promote your lymph flow and move lymph through the body. Build up any new activity slowly. Light weights are safe to use to tone and gain some strength. If you have lymphedema, wear your compression garment when you're exercising, because the muscles will work against the pressure of the sleeve or the stocking, and that will help promote the muscle pump that we want. Swimming is excellent if you can swim. The rhythmical exercise in the water, the hydrostatic pressure of the water will act as an extra pump, and that is very important for lymphedema management. Don't worry if you can't swim, the rhythmical exercise on dry land will work too. Avoid repetitive arm activity for more than 30 minutes. So if you are doing any activity, if you're using your arms, then try and alternate between arms and legs if you're not spending the whole time more than 30 minutes working on your upper or lower limb respectively. And avoid lifting any heavy weights or any vigorous exercise, but I would reiterate that light weights are safe. Just to chat through then early warning signs of lymphedema, your clothing or jewellery can feel tighter. Sometimes you can feel a heaviness, a tightness, or like a fullness in the limb, and it can ache a wee bit more than usual. It shouldn't be painful. Lymphedema on its own is not painful. If you have pain, you would need to be seen by your doctor to rule out an infection or a clot or some other cause for the pain other than your swelling. The swelling, when it comes initially, can be soft and pit easily on pressure. It can come and go and reduce overnight with elevation. The longer the fluid is there, it will be more persistent and might get harder and won't come and go overnight. This is just a few slides showing you the picture of a lady with lymphedema on her leg. You can see that the leg is still a nice shape. It's just that it's actually bigger than the other leg. And that's sort of when we would like to see patients, when the shape is still there and the fluid is not too much. Again, with the upper limb, again here, you can see some swelling in the back of the hand and in the arm. And this is just a few slides just showing you the pitting we were talking about, where the lymphedema is soft and it pits easily. So if you press into the top of your foot or the back of your hand or your arm, you can see that we'll leave an indent, and that's letting us see that the fluid is soft and pitting. And again, this is when we do like to see patients being referred when the swelling is nice and soft and easily moved. So what to do? If you do think you have lymphedema and you haven't been referred to the lymphedema service, do ask your complex skin cancer nurse or your GP for a referral to your local lymphedema service. Continue with any exercises you've been given and continue with a good skincare regime. If you feel you still have reduced movement, that may be in your neck, in your shoulder, or in your leg, and this is stopping you being more active, do again ask your complex skin cancer nurse or your GP for a referral to your physiotherapy department and continue with any exercises in the meantime that you have been given. Thank you for listening to me chatting this afternoon. And the last slide is just showing you the useful websites and the Lymphedema Network for Northern Ireland, the Lymphedema Northern Ireland Support Group, the Lymphedema Support Network, and also the Chartered Society of Physiotherapy website. And if you click on the patient and public information, that will give you some general information on exercise. Emer from the Move More team is going to talk about exercise and the importance of exercising moving forward after your cancer treatment. And so I will leave that for her to chat through that with you. Thank you.
Okay, thank you, Janet. Linking in with this, we'll now hear from Ema Hagan, who is our Move More coordinator based in Bangor. Ema will be talking to us a little more about physical activity and cancer.
Good afternoon, everyone. My name is Emer Hagan, and I am one of the Macmillan Move More coordinators. My job is to look after the physical activity side of your care and recovery. I am one of 11 Move More coordinators throughout Northern Ireland. We have one coordinator in every council area. So you'll have everyone on the call will have access to a Move More coordinator. Our role is to encourage everyone living with and beyond cancer to get active and to stay active. And it might be to get back into an activity that you've done before your diagnosis, or it might be to find a new activity that suits your needs now. We know there are huge benefits from being physically active, both socially and physically. Most importantly, we know that physical activity can help combat some of the side effects of the cancer treatment. Cancer-related fatigue is a massive issue that a lot of patients will talk to us about. That on not being able to shift that massive weight of tiredness off post-treatment and going through treatment. Now, a lot of the research now does show that the more physically active that you can be, the less that fatigue will reduce. There's also great social aspects to getting physically active, getting back outside after 18 months of us all sort of isolating, getting back outside, doing some walking, maybe back joining a group. My role in our Ards and North Down area is to encourage you to get as active as you can. It might not be within a leisure centre, it might be at home, it might be outside with the grandkids or children. But we do offer some Move More classes throughout the borough and across NI. All council areas will offer some different classes. There'll be some outdoor walks, outdoor activities, indoor Pilates classes, circuit-based classes, dance classes, etc. We are really, really conscious that people are maybe a little bit frightened still about coming into the leisure centre environment. But please let me reassure you that all classes are run socially distanced, masks are worn, and we have created a very safe and social environment for everyone to come back to the centres. Now, that might not be for you And you have an opportunity to have a one-to-one chat with myself or one of the coordinators to discuss what you would like to do and where you would like to do it. And Move More is very patient-centered, okay? So we can talk about activities that, as I said, you used to do, or maybe a new activity that you would like to try. And we can help you build a little plan to get you back feeling fitter, stronger and healthier. We know all adults across Northern Ireland aren't active to the levels that they need to be. The recommended levels is 150 minutes of physical activity throughout the week. And we know only 53% of the population in Northern Ireland can reach those levels. So I'm here just to encourage you, even if you're thinking about getting a little bit more active, even if we could aim to try to do 10 minutes a day of activity, it can be from housework, it can be going for a walk, a cycle, it can be going to the gym. It doesn't have to be something really, really structured that, you know, you think you have to be in a gym, etc. It can be at home. And we now have online resources through Move More. We have exercise DVDs that you can do at home, but we do also have the classes available and access to local leisure centres, gyms and swims. If you would like to get involved, please contact me on 077 18 19 4434. I will be available at the end of the talk for any questions or answers. And if you're not from the Ards and North Down area, please still get in touch with myself and I can pass you on into the correct coordinator's details. We are going to show you now a little short video of Move More and all that Move More represents and stands for. Just to make you aware, the video was made prior to COVID. So it was back in the times where there's no social distancing. So don't be alarmed. But it's a good wee flavour of the patient's view of Move More, what the classes look like, etc. And I hope you really enjoy it.
Afternoon, ladies. Everybody fit and well and ready to get active? Excellent. Let's get going. At present, 63,000 people are living with cancer in Northern Ireland. That means that 1 in 2 of us in our lifetime will be affected by cancer. Physical activity is often referred to as a wonder drug. It can help combat the side effects of cancer treatment. It can help reduce the occurrence of long-term health conditions and can also help reduce the chance of the cancer spreading and returning. We also know that physical activity and exercise is safe both during and after most types of cancer treatment.
I was diagnosed with cancer in December 2015 with lymphoma. I was a very keen cyclist, very fit. During my journey I put on quite a substantial lot of weight, from 15 to 23 stone. I got involved with the Move More programme simply because my wife volunteered me. I then went to the class, which I realised I wasn't on my own, and I never looked back.
Move More Northern Ireland helps people living with cancer get active and stay active. Macmillan Cancer Support funds the project, working in partnership with local councils, physical activity providers, health and social care trusts all over Northern Ireland to provide physical activity opportunities for people living with and beyond cancer.
Oh, we're burning this morning. Hands and feet together. That's great, okay? We'll just do 2 more and we're back to the march, okay? This one's fun. Sometimes it can be hard to know when to start to build up your fitness after you've received the cancer diagnosis, and that's where our Move More coordinators can help. Our coordinators can provide specialised and tailored support on an individual basis to help you get back to that level of fitness that suits you. Move More is not just about the gym or running marathons. It can be any activity that suits you and you enjoy.
Well, I'm David and I was diagnosed with a brain tumour just over 2 years ago. We've come here for exercise in the water, which is very pleasant, much better than exercising in the gym, I find. The water supports my weight and really enjoy it.
We have David here in the pool, and David's been swimming with us for about 6 months now. It's really helped his mobility and walking. It's not just about a gym, it's not just about classes, it can be any activity that you enjoy. It's about moving more.
My doctor told me into a test for bowel cancer. I wasn't going to do it, and I'm glad I did. If I hadn't had the operation, I'd be dead now. I've been told that. I enjoy every day. I try and give back as much to Move More, to Macmillan. Friendship is absolutely fantastic at these classes.
Taking the first steps can be daunting, but that's why we're here. We're here to make it easier and to make you feel like yourself again.
This is going to be exercise for the arms.
I try and make my classes as appealing to lots of people, so I don't want my classes to be boring. I want them to come along and have a range of different activities. So we maybe do a wee bit of Chinese and to warm up. We could maybe do a wee bit of Pilates, exercise to music, even boxercise, different activities. It's going to cater for everybody.
But dancing does not at all feel like exercise because you're concentrating so much on counting and following the steps. But certainly it does raise your heart rate a lot more than the Chinese element of the class.
You've been in the house so long by yourself quite a lot, as I was ill. So it is again the social interaction and just meeting people who are similar. It's a boost to your confidence really.
I started the classes when I was about halfway through 16 chemotherapies. I continued here whilst I was on radiotherapy as well. For me, I remember a lady saying to me, get out as much as you can when you're going through treatment, when you're feeling well enough, get out, be busy. Stay active, and that's very much what I did.
I'm Alison. I am actually a nurse in the breast care unit in the City Hospital. Ironically, I was diagnosed with breast cancer in July. We send a lot of our patients out into the community, and I actually didn't know what all Macmillan did. So, you know, whenever I was invited to come along to this exercise class, I mean, my eyes were opened at how much they support you and get you into exercise, and you know how important it is. Equally, meeting up with all the other people that are in the class.
Those are poles, just put the poles out to the front. Okay, so we're just going to rotate the left leg, okay, and now the right
Through
leg.
Move More, Macmillan wants every person living with cancer in Northern Ireland to become and remain active. Finding the right activity makes all the difference.
The support network that you have through the hospital or through Macmillan and through the friends that you meet at classes like this, it's that gets you through.
I move better, I sleep better, I eat better, quality of life just generally improved.
Life with cancer is still life. We'll help you to live it.
Okay, thank you very much, Emma, for sharing the video with us. It's great to hear from firsthand from patients the positive impact on physical activity whenever you do have a diagnosis. And as Emma said, there's a movement coordinator in each trust, in each council area in the South Eastern Trust. So if you'd like to get involved, please get in touch. So at this point, I'd like to introduce our final speaker, Karen Kelly, who will be giving us more information about cancer-related fatigue.
Hello everyone, my name is Karen Kelly. I'm Cancer Services Improvement Lead for the South Eastern Trust, and I'm delighted to be with you today to talk to you a little bit about fatigue management. So have any of you ever felt like this? I'm anticipating that the answer will be yes. It's not surprising given that between 80 and 100% of people affected by cancer are also affected by fatigue at some stage in cancer experience. In fact, patients and their families report that this is one of the most debilitating side effects of a cancer diagnosis. And that's because it can affect you mentally, physically, spiritually, and emotionally. Today, I'm going to take a look at what fatigue is, find out what causes that fatigue, and also what steps we can take to manage it. So what is cancer-related fatigue? It's unusual and persistent tiredness. It interferes with normal functioning, so not able to go around your daily tasks. not relieved by sleep or rest. You may find that after sleeping that it doesn't relieve any of your fatigue. And in fact, you continue to feel as if you're wading through porridge. It's not proportional to recent activity. It's subjective. And this is one of the main difficulties that people describe to us. It's very hard to let people around you know what fatigue is like, because unless they've experienced it, it's very hard to imagine. It's very different from tiredness. And that can make people feel quite separate and alone dealing with their fatigue. In fact, many people assume that fatigue generally accompanies illness and recovery, and therefore don't mention it unless it's asked. So what are the causes of this fatigue? Well, there are many. Sleep problems may be associated with your diagnosis and treatment and anxiety surrounding that. The lack of physical activity. You may have become physically deconditioned during the cancer experience. The cancer itself. Treatments can have an impact in terms of their side effects, such as pain. Anemia. Fatigue before your treatment. So you may have had a period of feeling anxious and coming up to diagnosis. And you may also have been fatigued by the cancer itself. Other medical problems, malnutrition. You may find that your diet has changed or your appetite throughout the cancer experience. You may feel ill because of treatments that you've received and then find it hard to maintain a good balanced diet. Medication. It's not uncommon for chemotherapy to cause that real fatigue. And emotional distress. So some of the emotions around receiving a cancer diagnosis and the impact on you, your family, and those close to you can cause huge emotional distress and add to that fatigue. So how does it affect you? So physically, we talked about how it can leave you feeling physically depleted, not able to carry out your routine tasks because you don't have the energy to do those, not able to participate in physical activities in the way that you once did. It can make you emotional. Once again, that feeling of isolation, feeling different than you were before, and that having an impact on you. Spiritual. So when we talk about spirituality, I think about our sense of connectedness to our deepest selves. And if you're not able to do the things you usually did, you don't feel like the person that you know, that you're expressing your full identity, and that can have a real impact spiritually. Socially, not able to keep up with hobbies, friends, the usual things that make you social. And again, that can lead to that emotional impact and isolation. So many of these are interlinked. Cognitive. Again, it can have the effect that it affects your short-term memory, your concentration, your recall. So that could show itself in a number of ways in your daily life. And an ability to watch films or programs and enjoy them. Not able to read and concentrate, not be able to remember small details. And all of that can make you feel like a compromised version of yourself. So we're beginning to see here the overarching effect of fatigue and how it feeds into so much of your life and why people tell us that it's such a difficult side effect to deal with. So in terms of the management of fatigue, there are two main approaches. The first is to try and treat the underlying causes. So it may be that there's some anemia, pain, or depression, and by treating those, that has an impact on relieving the fatigue. And treating the fatigue directly. So for example, through pharmacological or different medicines, or non-pharmacological, so different approaches to managing that fatigue. So I suppose we're talking here about the different approaches I mentioned earlier. One of those is to prioritize tasks, your daily routine, and what is important. So for everyone, that's different. For one person, it might be going to work. For another person, it might be carrying tasks. And for another, it might be, having time and energy to spend with your children after they come in from school. It's important then to plan ahead and set goals for leisure and work and reward yourself when you achieve them. So it's important to establish what the things are that are important to you, and then plan your energy levels so that you're able to do that and take satisfaction from that as well. Delegate on important activities. So again, different for everyone. For somebody, it might be gardening, another person, it might be cleaning, another, they might like additional help at work. So it's just about really thinking through all those different steps and figuring out what matters to you. and then pacing yourself during the day, the weeks, and the coming months. So rather than waking up in the morning thinking I have some energy, using it all, and then not having the energy that you need for the tasks that are important to you, it might be a case of waking up realizing you have some energy, but doing a little bit, taking a rest, doing another little bit, taking a rest, and making sure that you have energies for the things that are really important to you, like, for example, spending time with your kids. So, other things that we can look at to help with fatigue are managing stress levels and implementing relaxation techniques. So the whole cancer journey is a really stressful experience for people and those close to. And implementing those relaxation techniques can really help to manage fatigue. It's also important to do enjoyable and fun activities. I think that whenever someone's received a diagnosis, that it's a very intense and challenging period in their lives. And sometimes we can forget about the things that are fun and that can make us happy. We can get into patterns where those fall by the wayside. Those activities are so important, especially now, because it's those things that energize us and make us feel like ourselves. Nutrition. Okay, you may not be able to eat a large meal, but it will be about then looking at breaking that up into smaller meals throughout the day and thinking about the energy and how that's going to sustain you throughout the day. Setting your activity baseline and perhaps looking at how physical activity can help with your fatigue. I know that we have our Move More coordinators as described earlier, and they're a great resource to link in with to help to build your strength, stamina, and relieve fatigue. Good quality hygiene and sleep hygiene, and building in good routines to help you with your fatigue. So getting to bed at the same time, switching off your tech, sleep in a darkened room, keeping noise to a minimum. All those things are basic, but can really help with fatigue. And I suppose fatigue management is at its best when it's incorporating a little bit of all these things. So it's good to think of ourselves as a human battery and thinking about what supplies energy and what takes energy. What supplies energy is the relaxation, good nutrition, sleep, doing the fun things, the exercise and activity, pacing ourselves and setting goals. And what can deplete our energy is dealing with stress, family demands, anxieties of the have-to-dos, household demands, recovering from illness, return to work, and guilt. Sometimes people feel guilty because of their fatigue in terms of being able to carry out the tasks that they used to. It's so important that you let go of that because, and be gentle with yourself throughout your recovery. So with that in mind, I'd like to wish you a very good recovery and also to highlight some of the resources that are there to help. So you can contact your Macmillan Information and Support Service, as mentioned earlier, and they have a range of booklets and leaflets talking about how to manage fatigue and also how to build more physical activity into your daily routine. And you can also contact the Move More programme, and Emer had been in touch with us earlier talking about what's available there. Thank you for your time.
Okay, thank you, Karen. So we're nearing the close of the event, and at this point, I'd now like to hand over to Sheena, who's been keeping an eye on the questions that have come through, and she'll be directing those to each panel member. Okay, Sheena.
Yes, good afternoon, everyone, and thank you to everyone who's joined in and all the panelists. So there are just some questions that have come through this afternoon. The first one really is for Mr. Bond. And the question was, why did I have all my lymph nodes removed rather than just those with cancer in them?
Hi, can you hear me, Sheena?
Yes.
Well, it's a good question. The main reason is that, as we may have alluded to on some of the previous presentations, within the lymph node basin, so in other words, the collection of lymph nodes in your groin or in your armpit or your neck, there are more than just there's more than just one lymph node in the groin. There's probably anywhere from 10 to 15. The armpit, there might be 30, and the neck, there'll be over 50. And as a consequence, although on a scan you might see one abnormal lymph node, because the nodes are all interconnected, what you don't see is whether or not there's any microscopic seeding of tumour into the remaining lymph nodes. So to remove one lymph node will not necessarily clear all the tumour. So the rationale that we take is that we remove all the glands in order to try and ensure local control and to ensure to the best of our ability that all the tumour has been cleared. Now that is the current standard of care. It may change in the future, particularly with the advent of some of the new drugs that are used in the management of skin cancer. So it could be that in the future, maybe we will end up removing just a clinically or radiologically involved lymph node and leaving the rest of them to be managed with the drugs. But at the moment, standard of care is to remove all the glands to reduce the risk of relapse, essentially.
Thank you, Mr. Bond. The next question we had was from someone about, they were saying that they were still working, they wanted to plan to return to work, so they wanted to know who they can get information from regarding financial help at the moment, and also in relation to what's going to happen when they return to work. And I think maybe Nar is going to answer that question, please.
Yes, thanks, Sheena. So if you're concerned about any work-related issues, then we can schedule a work support conversation here in the service with myself or one of the support workers. And this is a guided conversation which informs you about your rights at work whenever you do have a diagnosis. But if you do have any concerns about finances, our specialist Macmillan benefits team can speak with you and would be available to offer advice about any finance or benefits concerns that you may have. So if you would like to hear more about that, just get in touch.
Thank you, Nor. The next question we had was from one of the participants who had said that they have had their lymph nodes removed from their leg and in their groin, but they have quite a bit of swelling in the leg, but they do want to increase their physical activity. So it was really to ask Janet and Emer maybe, if I know that you did cover that in your talks, but just this more specific area for this particular patient, please.
Hello, can you hear me? It's Janet here.
Yes.
I just want to
You want to put your camera on and then we can see you, please?
Oh, right, okay. We'll see if I can work out how to do that, Sheena. I'm new to all this.
It's okay. Thank you. We can still hear you if you can't get it on,
You
Janet.
can still hear me. I'm just not starting my video. Okay, hold on.
That's you.
Oh, hello.
Hi.
Yes, you can see. Yes, I was just saying, if you do have swelling at the top of the leg, it is still safe to exercise. It is good if you do have a garment to wear that. I'm not sure whether the patient in particular has a garment that they can wear to help support the leg when they're exercising, but we would advocate that with a garment on, that they should exercise if they can. If they find they're still stiff around the hip and the knee area, maybe following surgery, maybe need specific physio advice for that. But if the range of movement is good, we would encourage them to exercise. They may want to build that up slowly. Sometimes if you haven't done any exercise and you've had the surgery and had your lymph nodes removed, you need to just give your body time to adjust that increased blood flow and increased lymph flow to the limb when they're exercising. But we would advocate that they do exercise, wear their garment and build any activity up nice and slowly.
Thank you, Janet.
I don't know whether Emer has anything else to add.
No, not anything specific, Janet. I think you've covered it all there. But if the patient is on the call and they do want to increase activity and they're maybe not too sure where to start, please get in touch with myself, or if it's not me as one of the coordinators, I can definitely get you in touch with one to have a one-to-one chat with.
Thank you, Emer. that was all the questions that we had for now. So I'm just going to hand you back to Nar.
Okay. Thanks a lot, Sheena. Can I just ask all the panel members again to just turn your cameras off, please? Thank you. So that's really it for today. And we hope the message has been that regardless of what stage you are at in your treatment or beyond, you're not alone. We are all here. We all want to help and support you. We understand that there are many implications of having a cancer diagnosis, that there will be times when you need reassurances, when you need to talk things through. So please get in touch with us. We're still here. Your team is still here around you. And hopefully today we'll have given you some things to think about. So if you do need any information or have any questions, then please get in touch. And thank you for attending today. Upon leaving the event, you'll be asked to complete a short evaluation. Your feedback will be greatly appreciated as we continue to develop these virtual events. Thank you.